You've just been asked to schedule your first MRI-guided breast biopsy. Are you prepared? In this segment, we will present an overview of things that you may want to consider or have prepared prior to scheduling your first biopsy. First, consider, is MRI the best method? Evaluate if the lesion would be visible sonographically, as ultrasound is usually the preferred method for localization. A lesion of this size should be visible with directed ultrasound evaluation. This type of lesion is very unlikely to be identified with any degree of certainty and would therefore be most suitable for an MRI-guided procedure. If you have decided that the lesion is appropriate for an MRI-directed procedure, you must then evaluate if the lesion is accessible. Evaluate the location of the lesion in question and what your approach will be. Be aware of differences in accessibility depending on a lateral versus a medial approach. Is the lesion too deep to access? This lesion is very deep, and whether this would be accessible for MRI-guided biopsy is questionable. We have, however, found it is difficult to know for sure if a lesion will be accessible ahead of time. Often, with removal of padding on the breast coil and appropriate positioning of the patient, many deep lesions can be accessed even when using a grid system. If you have a deep lesion, not visible by ultrasound, and you are not sure if it will be accessible, you may want to discuss this with the surgeon ahead of time and make plans to leave a localization marker directly anterior to the lesion if in fact it turns out to be inaccessible. The clip can then be either wire-loked or subsequently found by intraoperative sonography with tissue deep to the clip excised. In a premenopausal patient, consider the lesion in question and as to whether or not hormonal augmentation could make lesion visualization difficult. This may require mild delays in performing a biopsy or localization to have the patient imaged in an optimal phase of their cycle. In this situation, phase of menstrual cycle would obviously be less important, as it would be very unlikely to obscure this lesion. In this scenario, an increase in background fibroglandular tissue enhancement could make identification of this region of asymmetric enhancement difficult, especially considering that the degree of lesion enhancement can be diminished by the compression required during a biopsy. It is advisable to establish a team of individuals for your biopsies. Besides your lead radiologist, this would include a lead technologist and nursing staff. Have a defined protocol for scheduling a biopsy. You may find it necessary to reserve slots during your week to accommodate biopsies, particularly as your practice starts to grow. You will need this flexibility in order to quickly schedule a patient, accommodating both the hormonal status of the patient and surgery scheduling requirements. Again, we very strongly advise one radiologist and one lead technologist to initially perform all MRI-guided biopsies. There are too many details and variations from one case to another to have a different radiologist and a different technologist each time. We feel the only way to gain expertise in MRI-guided procedures and to perform them smoothly is to have a dedicated team until your volume exceeds the capability of those individuals. Assure that you have nursing staff available. The nurse should know to call ahead of time and speak with the patient to delineate the specifics of the biopsy and address initial questions that the patient may have ahead of time. They are to give a procedure overview so that the patients come somewhat informed as to what they can expect. Try to assure availability of post-clip placement mammography to avoid your patient having to wait for these films. Once the patient's biopsy has been completed, the last thing they're going to want to do is sit around and wait for a mammogram. Consider these questions and assemble your team ahead of time. Clearly define the role of each member. These steps can go a long way to assuring that your first MRI-guided procedure goes smoothly.